Well, good morning. Thanks so much for starting your week with us. I'm Ryan Kalei-Suji, joined by Yunji Denise. This, of course, is Spotlight Hawaii. We are looking forward to a week of great conversations about a wide variety of topics. And today, Yunji, we have a guest on that always we have no short of information as well as content to go over with him.
Yeah, we see many of you already logging on right now. Lieutenant Governor Josh Green is joining us from his office live from the state capitol. Good morning, Lieutenant Governor.
Good morning.
We're so happy to have you on. Let's start with the vaccines. Where are we now? We always like to get the fresh numbers from you and some news regarding younger patients or younger citizens, rather, being able to get vaccines very soon.
So extraordinary progress. Hawaii is now number one in the country for the percent of our population 18 and older with at least one dose, 72.6%. That's special because that means we have significant immunity for all of those individuals, well, 72.6%, that would otherwise have a risk of catching or spreading the virus. We've now also completed 1.3 million plus shots. That's 1,334,012 shots, on our way to 2 million, which should complete the effort. So again, really good progress. We ordered 58,600 doses. We might get an extra 22,000 doses of Pfizer later in the week. So we have more than enough. And our operations, though, of course, there's less demand because so many people have actually been vaccinated. Our operation is up and running fully. And now we're reaching out to schools, as you mentioned, because as people know, 16-year-olds to 18-year-olds can get the Pfizer vaccine now. Special kudos to Hawaii Pacific Health, who's got their mobile unit out there vaccinating at schools. And this Friday or Saturday, the federal government will approve vaccinations for ages 12 to 15. It matters to me because I've got a beautiful 14-year-old who will get vaccinated, and we will speak to her pediatrician about this, but that's what you should do. You should talk to your significant other, your spouse, and of course your pediatrician and soul search on that. But I think it's safe, and they're approving it because it is safe. So that opens up another 55,000 potential Hawaii citizens which can get vaccinated and be immune. All of this will get us ultimately to a place where I hope we will have herd immunity. Much of the country won't reach herd immunity, we're now hearing, as we talked about earlier, but we will, I believe. And I think we're really on our way to being, if not the best vaccinated state, one of probably three best vaccinated states in the country, which is important because we see a lot of people from all over the country. And overall, I'm very proud of our effort. Another couple stats, forgive me for downloading so much information, but the percent of total population with at least one dose, that's at 58.2%. That's when you add the younger people. We're third in the country for that. So all of this will make a big difference. I expect to see in 2 to 3 weeks a serious drop in the number of cases because of our vaccination numbers. We will reach a threshold like they saw in some countries like Israel, where when they crossed over the threshold of 55% of their total population vaccinated, the numbers fell off like off a cliff. And that'll be welcome because, we still have cases. We had 61 cases today, 47 in the hospital. I really want to see us to get to low numbers like we had late last spring.
We talk about the success the state is having with this vaccination program, and yet we haven't necessarily seen a significant drop in the case counts. They've sort of been consistent. We're seeing, as the numbers you just reported, a little bit of a dip that goes down. Why haven't we seen the significant case numbers drop as we have more of the population seemingly getting these vaccines?
Mainly because people are out more, and it's a balance. As we feel more comfortable and confident because some people have been vaccinated, others are out, maybe not wearing their masks. And in spite of the large number of people that are fully vaccinated now, or even partially vaccinated, you still have a few 100,000 people that just have no immunity and are not vaccinated. So they can obviously still catch the virus. 89% of our cases remain local spread. 11% are somehow travel related. And most of those travel related cases are our own people returning. 7% out of that 11% are our own people returning from Vegas or California or wherever. So you can still catch COVID. There's still a lot of ways to catch it, but the best way to prevent it is being vaccinated, wearing a mask, otherwise socially distancing.
I want to speak to you as a physician and as a father to get your perspective on the people who are making those decisions, like you spoke about making for your daughter. There are people who feel like, well, the cases in kids aren't that severe. We don't know that much about the vaccine. It's so new, et cetera, et cetera. You've heard the pushback. What do you say to parents as they try to make that decision, especially because we have seen that children are able to overcome this more quickly than adults? Why is it still important for youth to get vaccinated?
A couple things. First of all, I will absolutely respect families if they choose to get their kid vaccinated or not. It's completely a personal decision. There's benefit, though, even though children will tend to have very minimal cases of COVID, they can then spread it to their siblings, to their class, potentially to their teacher, to their grandparents. There's just a lot of potential for spread of the virus still. So the idea really is to break the pattern of spread by getting vaccinations. Children are going to do fine. Very rarely do they suffer severe illness with COVID. Usually it's only if they have a severe underlying health condition like cystic fibrosis or some other lung condition. But to break the pattern of spread when they go back to school will be very helpful. They're on the bus, they are with their friends after school, they are with their babysitters, they're with their families. All of that can lead to spread. So really we want to get to herd immunity, or at least we want to get to critical mass of immunity and not have much spread. And to get there, we have 310,000 children under age 18 in our state. So we have 1.4 million people, but 310,000 of them are 18 or younger. And it's hard to get to 75% of 1.4 million, which is what's required for herd immunity vaccinated. And the good news is some of them are getting vaccinated right now, today, through many of our partners.
We, of course, like to bring in some of the questions from our viewing audience. Pat Yamauchi is asking an interesting question. How many vaccinated are in the hospital? How many have passed away after vaccinated? I'm not sure that you have those exact numbers, but I'm wondering if you can speak to that statistic. Have you been noticing that those in the hospital who are currently being treated for COVID-19, have we had any reports of those individuals having been vaccinated yet still catching the virus?
Yes, we have. We've had a very small number of people who were partway through the vaccination process, having had one shot of the Pfizer or Moderna, catching COVID and being hospitalized, but very few. Do keep in mind that 1 out of every 20 people who is fully vaccinated doesn't achieve full immunity. And that's something that is sometimes hard for people to remember, but that's actually a very good number. People who get the flu shot often only get 55 to 60% immunity, leaving as many as 40% of the people not protected from the flu. In this particular case, 1 out of 20 only. But yeah, we've had a few. Mostly, though, the benefit of the vaccine for them is they've had much less severe disease. They have not ended up on ventilators or died. So, it's a, kind of an important thing to remember that the vaccine does at least one thing, if not two, which is number one, prevent the disease from happening, and two, prevent serious illness.
Of course, another preventative step is mask wearing. Bernard has a question here. Is there still a mask mandate here in Hawaii? What's the Lieutenant Governor's thoughts on the CDC's recommendation of no mask needed outdoors if vaccinated and adequately distanced from others? Seems like the state of Hawaii is not following that recommendation. Let's get some clarity on masks, particularly outdoors. And then we do know that there was some progress in the legislature, obviously session is POW, about changing the penalty for not wearing a mask.
Yes. Okay. So there is still a mask mandate here in Hawaii. I would agree with both that caller and the CDC, and I've been pushing the governor and the others on the team to come more fully in line, although we're pretty close with the CDC guidance. The CDC guidance says that if you are fully vaccinated, you do not need to wear a mask outdoors. The governor has asked that we still be a little more conservative and make sure that you're at least 6 feet distant, so socially distanced from anybody if you are not wearing a mask. So if you're not wearing a mask, you better be at least 6 feet apart from other people. Having said all of that, I made a second attempt today to reach the team, sent them over a note saying, please, guys, let's make it possible for our families to be out there watching our kids playing sports, out there at tennis practice, outside around the soccer field or the rugby or football field, wherever that is, because it's kind of a loophole. Right now, you can go out and be in a picnic with your family and not wear a mask. You can be out there walking and exercising and not wearing a mask, especially if you're vaccinated, but you can't attend these events while you're safe. And that's got to be clarified. We're just really conservative in Hawaii, but hopefully I'll have something for you guys later this week on this. The overall intent is to continue to have people wearing masks if they're in big groups or clusters, because you just don't know who's been vaccinated and who hasn't. I would prefer the CDC guidance. And speaking to your other question about the penalties, so we had pretty draconian penalties earlier on. It was a misdemeanor offense if you did not wear a mask and you were out. If you couldn't demonstrate, obviously, that you're vaccinated, that was up to $5,000 fine and a year in jail. So the legislature did act. We had hoped that they would act in special session before. So last fall, it took an extra 7 months. But Senate Bill 540 is a good bill. It allows for the state or county officers to levy instead just up to a $200 fine for anyone who's breaking pandemic rules, such as not wearing a mask in public if they're supposed to, hosting large gatherings, or hiking on state lands closed to the public. So they can now just do something much smaller. I hate to be, so harsh, but on the other hand, we don't want spread of COVID as we get to the end of this process and vaccinate everybody. So that bill is on the governor's desk. I fully expect him to sign it. And it's just a more sensible way. It's kind of like jaywalking ticket or those kind of tickets. So let's be safe, everybody. And I will continue to nudge our leadership to make sure that they realize that it's safe enough to be out there watching our kids play tennis.
So let's say that the state does move to more of that CDC guideline saying that if you are fully vaccinated, you do not have to wear a mask outdoors. I'm wondering how law enforcement would enforce something like that. If they see somebody that's not wearing a mask, they go up to them, they ask them, have you been vaccinated? Do they have to show a proof of card that they are? And then if they're not, then they would get a citation. It just seems like it might be difficult to regulate and trust people who say that they have a vaccination and then having to then prove it in order to forego wearing a mask.
Oh yeah, it's super tough. There's no question about it, but there are ways, right? We know when you got vaccinated, when you didn't. If you get a fine, let's say someone was at a large gathering and no one was wearing a mask, and it became clear that it was kind of a rowdy event, and the police stopped by and people couldn't demonstrate then that they had been fully vaccinated, they'd have an opportunity to show later that the date was correct, that they had been vaccinated a week or a month or 3 months ago. So it could be handled. Really, mostly it's the honor system, and we just have to be sensible. But there are large gatherings out there that are occurring, and if we get too much of that, we want to dissuade people from having large gatherings where people aren't vaccinated and also not wearing a mask. That's where you'll see spread. But we're moving forward. Tomorrow's a big day. Tomorrow is the day where we're allowing for the Safe Travels program to utilize people's vaccination cards to travel within the state and their island. Over 5,000 people have already uploaded their cards. I'm one of them. And you'll be able to travel. You upload your card through the Safe Travels website. That's it. You do that, and then it's in there, and then carry your card with you. Okay, please carry your card with you, and we'll quickly check that when you come off the plane, and you're good to go. So here's the rules. I'll say it one more time because I know people are focused on this. You have to complete your vaccination process, which is both shots for Moderna or Pfizer, or the single shot for Johnson & Johnson, and allow a full 14 days to pass so you have achieved your full immunity. On that 15th day, you can do this. And so if you wanted to fly to Maui, you don't have to get the pre-test. You can just show your vaccination card after you've uploaded it. The reason we have people upload it is because you're also attesting that that was your card. And again, there's your honor system. I don't expect significant spread this way. I actually think that the vaccines are a great way to curtail spread. But out of an abundance of fairness, we want to make sure that if people just are happening to be against vaccinations or whatever, they can instead err on the side of getting a test. So you don't have to be vaccinated to travel. It's not like that. It's just yet another way for Safe Travels to work for us.
I want to drill down in the details on families who are traveling, and we've had some questions about this in the past. So in the past, for people who have children who are under the age of 5, if they got a PCR test, that extends to them. Does the vaccine extend to them as well? And what about kids who are in that limbo? They can't get a vaccine yet, but they're over the age of 5.
Yeah, under age 5, they're fine, no need. And then in the limbo space between like 5 and 11, well, it's actually at 5 and 15 for the moment, but it's about to, drop. If you have not been vaccinated and it's a child, they'll have to get the pre-test. Eventually, we'll move away from this, I hope. But this way, at least, it decreases the amount of testing people have to do by a lot, so families can travel more easily. Soon, we're going to get down to age 12, which is quite good. So then it will just leave that gap between 5 and 12, and I will likely ask for that to be exempted. I think it'll be time to not worry about that group. We're going to get to children as far as the vaccination program goes, but people are right to be a little bit mindful of that decision. This is again, a personal, like a deeply personal decision. It's been safe for adults. It appears to be completely safe for our keiki based on all the study reports, but I know how people are. They worry more about what would happen to their kid than anything else. And so that's a fair position. But for traveling between the islands, it's such an innocuous situation now. I would hope we can move away.
We have another question from Pat, who's asking, is there an approximate date when we don't have to get tested before returning to our state from the continental U.S.? Recently, I just got back yesterday from Ohio after covering the men's volleyball team. And I have to say, a part of our whole trip was just trying to get tested. We got 3 tests over the week because we didn't know when we were coming back. It does create a lot of challenges. And there's a lot of people saying, hey, I'm a local resident. I got vaccinated. Why can't we upload our vaccine cards and be included in the Safe Travels program? Is there an update that you can provide on when that might be possible?
Yes. So after 2 weeks, assuming this goes well, I will ask the governor to consider allowing us, we residents who were vaccinated here, to be able to utilize the Safe Travels vaccine exception also to apply for mainland travel or apply to mainland travel. I hope that he can approve that. I don't know yet. We've also talked about a date right after July 4th that we're targeting. We're targeting that we might be able to use just all CONUS travel, anyone traveling from the mainland, if we can demonstrate that they did get vaccinated. So we're working with partners, as we've talked about before, several of them. You've heard about Clear and Common Pass and First Vitals, IBM. So all of these guys are trying to work it out so that we can have a pretty seamless verification program. But for those of us who did get vaccinated here, it shouldn't be any different. And so I just want to make sure our program is moving smoothly so we can start doing that. It makes a lot of sense. And it was just fantastic that you were able to get over to watch our team become champions. So that's super cool.
We got 2 questions here. I just want to show them both back to back because they address the same issue. Mindy saying, what is the LG doing to ensure schools fully open fully in the fall? And Ryan says, what do you expect schools to look like the next school year, 2021 to 2022?
So I expect schools to be completely open. First thing we did is we expedited all of our teachers and support staff getting vaccinated. And that was done actually so that we could open up in the final quarter of this year, which many schools were able to do. There will simply be no excuses not to be fully open in the fall because, number one, the state of Hawaii will have reached herd immunity. So it's not really a problem. 2, children will also be allowed to get vaccinated at least down to age 12 by then and probably down to age 5 by then. So once again, we will be safe. So that's what we're working on, and we're working to expedite. So that's what I'm doing with my team and with the Department of Health and the Department of Public Safety and so on. I think school looks normal next year. Sure, there will be mask wearing for some, although by that time, it appears that the CDC will have given us guidance that we will not have to wear masks indoors. They're already teasing that. We heard Dr. Fauci talk about that. He's already advised the president that he's beginning to think that we don't have to wear masks indoors if we're vaccinated. And that's probably going to apply to schools too. So come August, September, it's going to be more normal than people think. But if people are sick, if they have any symptoms that would suggest COVID, we'll recommend people getting a test before going into school, just because we don't want to see mini outbreaks at some of our public schools.
I'm wondering what the future of vaccine looks like for the state of Hawaii and just for everybody in general, I guess, moving forward. We know that there have been reports that there would be a booster shot needed, maybe 6 months, 8 months down the line after someone initially got their first shot. We are in the month of May. And so those conversations is something that will be coming up soon. Will the state continue to have these facilities open for a booster shot, these mobile units? What does that second shot look like moving forward, or maybe third shot in some cases, I guess, but that booster shot look like moving forward, and how is the state planning for that?
It looks like it will be done at public facilities, I should say like pharmacies. That's most likely going to be the way we handle this. So I think that's going to be much more focused that way and at doctors' offices than it was in the past. There might be some need to have a couple mega sites, but I would guess that we would then just do them for a couple weekends where we had an opportunity for people to pop in for a day. and get a booster. One of the nice things about that will be it'll just be one shot, of course. So it's not going to require the same kind of documentation. You would just get a sticker that demonstrates that you've received your booster shot on top of your first 2 shots, or Johnson & Johnson's 1 shot in that case. We're still awaiting guidance to see whether or not they're going to insist that it be the same company and therefore the same type of immunity. That's kind of important, and those studies are going on right now. The main thing is to keep us from having a surge, and also we want to keep immunity up very high because there's parts of the world that are not able to stop COVID. India, for example, with over 1 billion people, is going to have a lot of cases, hundreds of millions of cases, and that means variants, and that means spread to Europe, which could come to United States and Hawaii, of course. So it'll be a booster shot. It'll probably be 6 to 9 months after the first, and some people are coming up on that anniversary. I get it, but every study I've seen has suggested the immunity is holding, and we're seeing cases drop. They're down to about 42,000 cases a day on the mainland, down from as high as 70 to 80,000 cases a day. That's going to keep going way, way down as we go through the end of May. All of this bodes well, but expect to get a booster shot probably at a private pharmacy.
Interesting. The last time he was on here, Honolulu Mayor Rick Blangiardi said that at some point he'd like to abolish the tier system. He basically said that when the tier system was created, it didn't have the variable of the vaccine as part of that, calculation. And so he felt that, those parameters really weren't valid anymore. What are your thoughts on the tier system? Should Oahu keep that in place? Or do you think that it doesn't serve a purpose anymore?
It should evolve. That system has to evolve because Mayor's right. He and I shared that conversation. We talked at great length about this. Absolutely, with the vaccines in place, we do not have to be beholden simply to number of cases in different regions, because most importantly, we have to know that we can contain the virus, not have too many people in the hospital, and not have our facilities, endangered, like our long-term care facilities. Because all of that's been handled, it's perfectly reasonable to adjust the tier system. And then in time, this whole thing's going to go away when we are able to state that we have either herd immunity or widespread immunity with very minimal outbreak. So I think that's when it goes away completely. Until then, I think it's reasonable for the mayor to appeal to the governor and ask that we not go backwards when, frankly, things are going pretty well. We have 24 individuals over at Queens in the hospital, and that number is just peaked and it's coming back down again. But otherwise, statewide, very few cases. Only a couple cases over at Hawaii Pacific Health. On Maui, they're down to 4 cases. You remember just 2 weeks ago, it had kind of spiked upward. And so all of these places, all of our mayors, they each like to have a little bit of nuance and extra protection that fits their county. But I can tell you, the case counts are really low. Here's some other information. You know how they did the second test on Maui after arrival again? The first 5,000 tests were negative. All 5,000 of them were negative. So that demonstrates that the Safe Travels program is still completely safe, and we have minimal spread, if any, from travelers. So it's really better for us to focus on getting our ducks in order as far as our own vaccination program and being immune, and then moving on. And I think that people are right to have grown tired of talking about tier systems and talking about further restrictions when it's been months and months now where our hospitals have been more than available for anyone who's sick. Because in truth, there are a lot of illnesses that are more impactful now than COVID because we moved past the crisis.
I wanted to get to, of course, as we talk through this vaccination program and the efforts of the state really to get us to herd immunity, a lot of that is to begin to reopen our economy and to welcome back the tourism industry. And yet there is this sort of disagreement with how the tourism industry should proceed. Recently, the legislature cut funding to the Hawaii Tourism Authority and restructuring of the organization. Some opponents to that say that this is a time where we need to invest in tourism so that we can restructure the way in which we bring travelers back to the islands. I wanted to get your thoughts on the role that HTA should play in this rollout of what travel looks like to the islands moving forward.
Yeah, my general feeling is probably it would be better to not cut the HTA right now. I have a lot of faith in them. I know there should be change. Again, tourism should also evolve. But 21,936 travelers came from the mainland yesterday, and we need them to be well informed, to understand what's safe in Hawaii. We need to navigate the transition right now where we have a lot more domestic travel. We don't have travel from the international communities. The international traveler is going to have to be rebooted, basically, once we have travel that's available from Japan, Korea, Australia, New Zealand, so many other places, Europe, while they have problems or complications still with COVID. So I'm not too keen on the cuts at HTA at present. Again, I think we should see that they can demonstrate that they can evolve in fairness to the committees in the Senate and the House. I have a lot of respect for them, but I'm a little worried about that. And all things being equal, that amount of money is really not, it's not that consequential compared to the billions of dollars that will come to Hawaii to pay for ambulances and schools and so many things. And I also think that this is a time where Hawaii should be making the case that we've been the safest place to travel to in the world. We've managed COVID better than any other place at all. And if we're going to evolve travel and hospitality so that we have a slightly smaller footprint, smaller numbers, but more revenue, these are some sales pitches that I think we should be making very clear globally. And in order to make those arguments, it can't just be me on YouTube and TV. It's going to have to be a lot of professionals expressing what Hawaii was able to do successfully. So I think at this transition point, I would not like to see those cuts. I can't speak for the governor, whether he will sign or veto certain bills. That's obviously completely his prerogative. But that one, I wasn't so hot on.
There's a question here from Heidi, which sort of speaks to these two things coming together, which is, how do we maintain herd immunity? You know, you said at the top, Hawaii's doing so well with vaccine buy-in, but how do we maintain herd immunity with 10 million tourists arriving in a year? If we have all these folks coming in, how do we, even though we've all gotten vaccinated, how do we, you know, stay safe?
There's a conceptual disconnect there on this point for Heidi to understand. So our herd immunity is inherent to what we have here. It's not a question of whether or not an individual is immune when they come. It will be herd immunity that is already established in our state. Once you reach that critical mass of herd immunity, you have the immunity. What you don't want is you don't want the immunity to fade. So that's why you have booster shots. But you don't worry about the handful of travelers that come in, and it will be a small handful that could have COVID. Now, having said that, we are going to have two different criteria for travelers, at least through this year. They will either be vaccinated fully and have therefore really low probability of having COVID, or they're still going to get a pretest. And that has proven 88% effective to weed out other cases. But we will maintain our herd immunity, and we'll still be monitoring things. Don't get me wrong. We're still going to be checking very carefully that our hospital numbers don't go up, that we don't see outbreaks. But I don't think that that's a large threat for us. The larger threat would be not achieving herd immunity and opening up wide without a safe measure. And so we're doing both. We're going to get herd immunity because over 75% of our people will be vaccinated, probably a lot more than that once it's all said and done, and keep kind of up the safeguards. The safe travel system will not go away until we feel extremely comfortable that we don't have to worry.
Our time is wrapping up here, but we did want to allow you an opportunity to have one final message to our viewers out there who are watching, and anything you would want to say as we begin this next week here.
Sure. Well, thank you. First, just thank you to everybody for being so thoughtful about this process. Like I said earlier, we are number one in the country at 72.6% of our adult population, 18 and older, getting vaccinated, but that leaves 27.4% of us over age 18 who have chosen still not to be starting the vaccination process. And that's a lot of people. So if you're going to get vaccinated, if it's something you believe in, go now. This is the right time. Go to any of our places, go to hawaiicovid19.com and sign up, get vaccinated, because that's how we get to normal much more quickly. It's how we protect our children and our kupuna. That's the right thing to do. So again, do that, and we can continue to celebrate things like Mother's Day, like we did, which was an extraordinary thing to be able to hug our moms again and do it safely. So please consider that. I'll give you updates as long as you will have me and as long as you need them. Just know that Hawaii has done all that we can, but it's only because people have been so thoughtful throughout this process as a state.
Okay, Lieutenant Governor Josh Green, thank you so much for joining us live and starting the week off with us. We appreciate it.
My pleasure. Take care.
Thank you. Aloha.
Well, Ryan, very interesting to hear. We're going to have those 12 and up very soon eligible to receive the vaccine. And that opens up, he said, over 50,000 people who will be eligible here in the state to get vaccinations. Of course, that's a conversation he suggests you have with your pediatrician first. But, more and more teens and tweens, and eventually, he said 5-year-olds and up, probably before or at least during some part of the school year this fall, will be eligible for that. And that could really be a game changer when it comes to education, which we know so many of our viewers care about.
Yeah, and interesting to know. He's saying that school year will look like how it used to look, right, in the coming school year. So looking forward to him saying that there are going to be that opportunity for students to not only be in classroom, but to able to return to that sense of normalcy that we know has really impacted our students over the past 2 years. And also hearing his thoughts on the mask mandate, saying that the state should maybe adopt what the CDC is recommending in terms of those vaccinated and not having to wear that mask when they are outdoors, following more in line with what the CDC recommends than currently what the state is mandating under that mask mandate, which is a little bit more restrictive than what we're seeing in other states.
Yeah, and we are seeing, of course, as he highlighted, the changes to the Safe Travel program with the vaccine verification taking effect this week for Neighbor Island travel. That's for Hawaii residents only. Eventually, he expects that to open to travel to and from the continent, and eventually to non-Hawaii residents as well. You happen to be one of those folks that was traveling this week, as you mentioned, and I want to just put this quick comment from Diana here. She says, Ryan, I'm still on a high from our UH men's volleyball team taking the NCAA title. Chee-hoo! So let's hear it for that. Just real quick, I know that what an exciting weekend for Hawaii, and what an exciting weekend for you personally, just to be there on the sidelines. Tell us a little bit about Columbus.
Yeah, I mean, it was really an unbelievable experience. I mentioned earlier, I felt like I was in Groundhog's Day because we were in this team bubble and we did the same thing every day, practice, team meals. But really, it was all worth it once we were able to see the team celebrate. This is actually the team on match point during this time, from my perspective, being able to be on that sideline and have the team rush the court. And, the striking thing that I got when talking to these players after the match, when interviewing them, all of them said, this is for Hawaii and this is because of Hawaii. And they didn't see it as a culmination of all the hard work they did, that they worked hard, that they had to overcome during this COVID season. They wanted to do this for Hawaii. Hawaii has not brought home a team national title since 1987, and they recognized the significance of this and how important it was. There you see the player, G, he's wearing the Brazilian flag. He talked about the story of how he spent 1 month just getting from Brazil back to Honolulu in the time of COVID because of all the restrictions and the quarantine periods that he had to go through. So these players had to go through a lot in order to make this season happen. And I think a lot of the states still celebrating in their victory here.
Yeah, absolutely. I saw on some of the social media stuff that you were posting of the governor, live streaming to say just thank you on behalf of the citizens of Hawaii, because you're right. This is so meaningful to have a win like this. Lucky for those fans, the handful that were there in the stands. I know so many people here in Hawaii would love to be back at the Stan Sheriff Center and to be actually feeling that energy themselves. But it was wonderful to watch from afar.
Yeah, and it was just a great experience to be part of. And there will be more celebrations throughout the week that will be announced where people can get their chance to see this team and congratulate them as well.
We've got a lot coming up on this week as well. On Wednesday, Lori Kahikina, the interim CEO of Heart, is going to be coming on here to join us to give us an update. The last time she was here, she gave us some pretty astounding numbers, breaking some news just on the cost overruns. So we're going to be talking to her more about what the plan is. The mayor, the last time he was on, indicated that, it could end at Middle Street. He's not quite sure yet. And then on Friday, we have Colleen Hanabusa will be joining us. She, of course, has a new position with the rail project, and she'll be talking to us about her strategy to try to help get this project completed, and answering a lot of your questions on that.
Yeah, going to be an interesting conversation for sure. We know that there are a lot of people who will be tuning in with their comments for that. We thank you for joining us. We thank the Lieutenant Governor, and we will see you right back here on Wednesday for another edition of Spotlight Hawaii. Aloha.
Aloha.